Hey everyone, Dr. Casey Edmondson here from Shoreline Spine, and today we're going to talk a little bit about a condition that can cause some seriously frustrating symptoms. That's called thoracic outlet syndrome, or TOS. If you've ever dealt with numbness, tingling, or weakness down your arm, this might be the reason why. What is the thoracic outlet? Now, the thoracic outlet is a small space between your collarbone and your first rib. Through that space runs a bundle of nerves, blood vessels, and muscles that supply your arm. Think of it as a highway. It's how your brain communicates with your arm and hand. That space gets cramped, congested, or irritated. That means that there's a traffic jam, and that is called thoracic outlet syndrome. Common symptoms include numbness or tingling down the arm, weak grip strength, shoulder, neck, or arm pain, a heavy or tired feeling when holding your arm up, sometimes even discoloration or swelling if the blood flow is affected. These symptoms typically worsen with certain positions like reaching overhead, driving, or even sitting at a computer for long periods of time. Now, thoracic outlet syndrome can be caused by several things, like a cervical rib, like we see on this patient here. This is when you get an extra rib actually in the neck that you're not supposed to have, and it causes some compression to that thoracic outlet area. Then there's trauma, like whiplash or sports injuries that can cause it. And then there's surgeries that change the posture or the scar tissue patterns in the area, specifically surgical fusions, or it could simply be due to poor posture. When you have those rounded shoulders and the tight neck muscles from modern life, the phones, the laptop, long hours sitting, that's a big one as well. Now, here's a quick test that you can do right now. It is called the ruse test. What you want to do is you want to bring your arms up about a 90-degree angle, looking like a field goal. Now, you want to open and close your hands repeatedly for about 2 to 3 minutes. And if your arms become numb, weak, heavy, painful, or if they change colors, or even if you feel like your arms are just going to fall off, that is a positive test and a strong indication of thoracic outlet syndrome. Now, here's where chiropractic really shines. If that first rib, clavicle, upper thoracic spine, or neck is misaligned, it can physically narrow the thoracic outlet. Now, by making these adjustments to these misaligned segments, it really opens up the space and takes the pressure off the nerves and blood vessels. It's like opening up that congested traffic lane. Suddenly, messages can get through again, symptoms reduce, and the arm can finally feel normal. Now, while you're waiting to get treated, there's a simple stretch that you can do to provide some temporary relief. You're going to want to take a belt or a towel, roll it up, and get the hand or the arm that's giving you the trouble, put it over that shoulder. You're going to grab the other arm and push down as hard as you really can. And then you're going to lean your head to the side, try to get the ear to touch the shoulder, bring your other hand behind you, and make circles while breathing in deeply. Do that for about 20 to 30 seconds. And what this does is it helps decompress the nerves by lowering the shoulder and lengthening those tight muscles in the neck. It also helps improve circulation. Now, if you tested positive or your symptoms sound familiar, don't ignore them. Thoracic outlet syndrome will not fix itself, but the right adjustments, the mobility work, and the postural corrections can absolutely help. I'm Dr. Casey at Shoreline Spine, helping you move better, live better, and get back to doing what you love. See you soon.